Today, we're jumping into a totally different way of looking at scoliosis, one that goes way beyond just measuring the angle of a curve. We're talking about a unique system called the JESU5C scoliosis code. Yeah, I know, it looks a little strange, it's pronounced JESU5C. But the idea behind it is actually incredibly simple and pretty powerful.
So let's just start with this one question. What if you could understand and even treat scoliosis, not just by how severe the curve is, but by recognizing that it forms a distinct, predictable shape? That's really the core idea we're going to unpack today.
You see, this system suggests that most cases of what's called idiopathic scoliosis, which is just a medical way of saying there's no known cause, can actually be sorted into one of 6 basic patterns, and they're represented by these characters you see here: J, the Greek letter epsilon, S, and under 5, a 5, and C. You can think of each one as a visual blueprint for a specific spinal shape.
So you might be wondering, why even create a whole new system? Weren't the old methods good enough? Well, the motivation behind it was super clear and honestly pretty powerful. It was all about benefiting the patient. This whole thing was designed to improve treatments, sure, but just as importantly, to cut down on the risk of making mistakes.
Okay, so let's dig into that a little deeper. Why was this new blueprint necessary in the first place? What wasn't working with the old way of doing things?
Now, what's really cool here are the practical, real-world reasons. This wasn't just some academic theory. It was built to create a clear system for a specific hands-on treatment called HGMT, giving doctors a common language to use. But maybe the most important part, it was also designed to be a predictive tool, helping doctors actually anticipate how a person's scoliosis might get worse or change down the road. That's a huge deal.
All right, let's get to the main event. What exactly are these 6 patterns, and how do they help classify scoliosis just by looking at its shape?
So, the official definition is that the JESU5 pattern is a way of classifying scoliosis that's based on what you can actually see. You look at the patient's posture, their overall body shape, and then you confirm it with X-rays. It's really a shift from just relying on abstract numbers to identifying tangible, recognizable shapes.
But here's where it gets even smarter. It's not just 6 rigid categories. First off, each pattern has a symmetrical, reverse version of itself. And because the body is constantly changing, these patterns can actually blend together or even evolve over time. For instance, a patient might start with a J pattern that later develops into a 5 pattern. That change is a critical signal to the doctor that it's time to adjust the treatment.
This table gives us a fantastic snapshot of the whole system. The J pattern is the most common and, fascinatingly, is often linked with digestive problems. Then you have the epsilon pattern, which is tied to an imbalance at the very base of the spine and is usually pretty painful. The classic S pattern is another really common one, but here's a surprise: it tends to cause less pain. The under 5 pattern has its main curve in the upper back and shows up more often in men. The 5 pattern is defined by some serious rotation in the lower vertebrae. And finally, there's the C pattern, where the person's whole body shape can appear the most distorted.
So identifying the pattern is step 1, but the real breakthrough is connecting that specific pattern to a specific treatment technique. Let's break down the clinical logic here. The process is just so direct and logical. It's a simple 3-step pathway. First, you analyze the patient's spinal shape. Second, you identify which of the JESU5C patterns it fits. And third, you select the exact HGMT technique, that's the hands-on therapy, that was designed specifically for that pattern. It creates this beautiful, clear line from diagnosis straight to action.
Okay, so what do these treatments actually look like? Let's take a closer look at a few of these HGMT techniques to see how they pair up with the patterns.
This is a perfect example of how dynamic the whole system is. For S and J patterns that have some rotation happening in the lower back, a practitioner starts with something called the GB39 technique. But, and this is key, as the patient's spine improves and that rotation gets better, the treatment has to adapt. At that point, the practitioner actually switches over to the SP6 technique. It shows the treatment isn't just a one-and-done thing. It literally evolves as the patient heals.
And you see this lock and key logic all over the place. A C pattern corresponds to the PC7 technique, an under 5 pattern calls for TE11, got severe rotation in an S or 5 pattern, you're using GB40. The whole point is that there's no guesswork. The diagnosis itself gives you the roadmap for the treatment.
Now, all of this sounds great in theory, but how does it actually play out in the real world? Let's turn to a couple of case studies from the source material to see how this system gets applied to real patients.
Okay, so our first example is case study 5.
This was a patient who was diagnosed with an under 5-spotter pattern of idiopathic scoliosis.
Before the treatment, this patient had a pretty significant curve. In scoliosis, they measure this using something called a Cobb angle. It's basically the standard way to put a number on how severe a curve is. Well, after they applied the specific HGMT technique for that under 5 pattern, there was a really clear, measurable improvement.
So just how significant are we talking? The patient started out with a Cobb angle of 43 degrees. And after that pattern-specific treatment, the angle dropped to 32 degrees. That's an 11-degree improvement. That is a clear, quantifiable win that's tied directly to using this diagnosis method.
Now for a really fascinating case. This is case study 7. The patient had a clear 5 pattern, but it wasn't idiopathic. The cause was something totally different. Tension from surgical scars from an operation they had as a kid.
This timeline just perfectly captures the recovery journey. They started with this curve caused by scar tissue. By using the correct HMGT technique for a 5 pattern, they were able to get the Cobb angle down to 7 degrees, then down even further to 5 degrees, and ultimately they achieved a complete correction, bringing it all the way to 0 degrees. Just an incredible result.
So, if we boil it all down, the JESU5C system is so much more than just a new set of labels. It's a visual framework, it's a blueprint that creates a direct, logical connection between the specific shape of a person's scoliosis and the targeted, hands-on treatment designed to fix it.
And that leaves us with a pretty compelling question to chew on. Is the future of scoliosis treatment about looking at the big picture, or is it really about zooming in on the specific shape? This system makes a very strong case that the true key to unlocking correction lies in understanding the unique pattern of the curve itself.